Look at Aurora.
Thank you, Speaker. Speaker, my question is to the Minister of Health. Yesterday, we revealed that the Premier and his cabinet approved the Mazza scheme against the advice and warnings of senior civil servants. The Minister, in her response, said this, and I quote, "It's clear that with the benefit of hindsight, we would have had a stronger performance agreement," end of quote. Well, Speaker, what's clear is that even hindsight can't help this minister to get it right. Given the alarming number of calls to which Ornge has not been able to respond because of down staffing and unqualified staff being available, one would have thought that the most important change to the performance agreement would be to entrench clearly defined service levels in that agreement to which Ornge could be held.
Question.
Speaker, I'd like to know from the Minister, why is there no reference in that performance agreement to specific service levels to which Ornge would be held accountable?
Thank you. Minister of Health.
Speaker, there are significant changes underway at Ornge, and we are absolutely committed to strengthen oversight at Ornge and to improve the quality of care that patients are receiving. One of those, the ways we're doing that is by collecting information that was not previously collected on a range of issues. Speaker, and I'm very pleased that Bruce Farr has joined the leadership team at Ornge. He has a long history working with Toronto EMS, started as an ambulance driver in Scarborough. He's now moved to the training division and was eventually promoted to the position of Chief and General Manager. He retired, Speaker, from that position and is now in a leadership role at Ornge. His experience, Speaker, in providing strategic direction, operational planning and leadership will prove indispensable, Speaker, and we look forward to continuing to strengthen.
Thank you. Supplementary. From Renfrew is now warned.
I can't.
To be clear, the member from Renfrew, Nipissing, Pembroke is warned.
Speaker, repeatedly in this place we've heard from the Minister that the new performance agreement will set standards. She now, the Minister, has refused to respond to my very specific question about levels of service that should be defined in that performance agreement.
Minister of the Environment will come
I quite frankly don't care how many new people are there. I want to know what the Minister's doing about incorporating levels of service into the performance agreement to which Ornge can be held. Speaker, there are none. I'd like to know from the Minister, why not?
Minister of Health.
Speaker, to the Minister of Community and Social Services.
Government House Leader. Member from Halton, come to order. Government House Leader.
Mr. Speaker, again, I never tire in reminding the member that a committee of this legislature, the Public Accounts Committee, is seized with this matter, and if he insists upon holding hearings on the floor of the legislature, as I said, Mr. Speaker, there are a variety of issues that we want to talk about on this side. For example, why did Ornge locate its headquarters in Oshawa instead of Peterborough against the advice of senior Ornge executives when we find out, Mr. Speaker, that there was lobbying on the part of the Conservatives? Will we ask, Mr. Speaker, about Kelly Mitchell and the work he did in terms of lobbying the Progressive Conservatives putting together?
Speaker, back to the Minister of Health.
Hasn't she resigned?
Speaker, the most critical issue at Ornge is the fact that lives have been put at risk because of Ornge's inability to respond. In the vast majority of cases, the reason for that is understaffing of qualified paramedics and pilots. Speaker, there was a time in Ontario when Ontarians could count on their air ambulance service to respond to both critical, advanced, and primary care responses. Essentially, the fact that there is no reference in the performance agreement to either critical care response or advanced care response reduces our air ambulance to a very expensive medical limousine service. Is this the Minister's new vision of our air ambulance service?
Minister of Health.
Well, Speaker, I would urge the member opposite to actually read the performance agreement. I would urge the member opposite to support Bill 50, Speaker, legislation before this House that will enhance transparency and oversight at Ornge. The new performance agreement, Speaker, will give Ontarians better air ambulance care. It appoints a new patient advocate. We will publicly posting a complaints process. There will be annual public surveys on performance. The member opposite wants performance indicators. So do we. They're in the performance agreement, Speaker. There will be improved reporting of emergency dispatch information. We will be including cancelled and declined flights and land ambulance calls.
Answer.
Speaker, these are all important enhancements to Ornge, and I really wish the member opposite would just support Bill 50.
Supplementary.
Well, Speaker, you have called for an answer. I'm expecting an answer. We're not getting an answer to my question. I have it. Not only is there no reference in that performance agreement to critical and advanced care standards of care, I have it on good authority that Mr. McCurley, the minister's new CEO, has in fact now asked the ministry to water down the regulations governing paramedic qualifications. He is asking for regulations to reduce the requirement of having 2 paramedics down to 1 paramedic to qualify for an air ambulance staff. This contradicts even Ornge's internal medical advisory committee. Rather than demanding compliance with existing standards, the minister is now going to be complicit in actually compromising patient care. I'd like to know from the minister, why will she not, at least in this case, take the advice of her Emergency Health Services branch, which is advising against watering down that regulation, and stand up for patient care?
Thank you. Minister of Health.
Speaker, rather than dealing with hypotheticals, which the member opposite has become famous for doing, I think it's important that we deal with the facts, Speaker. The fact is, the members opposite are blocking passage of Bill 50, Speaker. It is shameful. Shame. Meanwhile, Speaker, the frontline staff at Ornge are saving lives every single day. Just yesterday, Speaker,
Ever from Northumberland, come to order.
The frontline staff at Ornge had a rotor-scene patient, 1 rotor-scene patient, Speaker, 36 interfacility transfers, 15 patients were transported by land ambulance, and 10 pediatric patients were transferred by Ornge. The member opposite wants to criticize.
Answer.
Speaker, I think it's time that the member opposite stood up and said thank you to the frontline staff at Ornge.